Erin with Best Life Physical Therapy. I'm here today to show you how to use a lacrosse ball to release the tight knots that you might find in your hip sometimes. It's really important to identify when you have a tight spot in your hip, because if you do, then the low back is going to have, if the hip is tight, then the low back is going to have to move more. And actually what we'd like is to have mobility, movement at the hips, and stability at the spine. So it's really important to take care of these tight spots in our hips as soon as we find them. So what we're going to do, we're going to take our, with a little knowledge of anatomy, we're going to know that the sacrum is like a V shape in the back. It comes down to a point at the coccyx or the tailbone. So what you're going to do is place the ball to the right or the left of that V, not directly on the bones. And you're going to just place the ball there and lean with your body weight against the ball. If you have your feet out farther, it's going to be more weight, and if you have your feet closer in, it's going to be less weight. So you get to modify this and for what's right for you today. So what we're going to do is we're going to start at the bottom of that V and just kind of start to roll your body to the one side. So right now I've got the ball on my left hip, so that when I roll toward the left, I'm moving along the muscle. And I might find a spot in there that feels pretty uncomfortable. And if I do, I'm going to pay attention, because if it's a spot that's really uncomfortable, like nerve symptoms, like electric pain down the leg, I'm going to get off of that. That's the sciatic nerve. You're right on it. And that's another reason why these muscles are so important to address. All right, so what I've done is I've started at the V and I've moved out until I found pretty much the most impactful spot for me right now. And so what I'm going to do is I'm going to shift my weight onto my right foot. I've got the ball against the left hip. I'm going to place my left foot in the arch of the right foot, and I'm going to make a little clam shape with my leg. And I'm going to come in and out and in and out 10 times. And this, in essence, is creating your very own active release technique. So we're using that muscle to move, and we're putting pressure into it at the same time so it releases. And that's about 10 of those. So now I'm going to change gears a little bit and come out and just bring my leg straight out to the side. And as I bring that leg out, I can feel the muscle activating or tensing up or contracting underneath of that ball every single time. And we just do 10 of those as well. And now, after 10 of those, we're going to go ahead and do a bicycle leg motion with that leg. And for some people, that bicycle leg is the most impactful one. For some other parts of the muscle, it is the clamshell or maybe the hip abduction. But you'll want to use the most impact. You can do 30 of the same motion if that was the most impactful for that spot. This muscle is kind of a fan shape, so there's not one motion that's best for all of the pain. So now, after I've done 10 of those, I'm going to just kind of sit here and listen. And actually, my spot that I'm on right now doesn't even feel painful anymore. But if it was still painful, what I would have you do is take 3 deep breaths. So I want you to breathe in and bring that breath all the way down low into that hip. Maybe we hold it for a couple of seconds there, and then exhale even more slowly than you inhaled. So count that out on the next breath. So we're going to breathe in for 2, hold for 2, exhale for 6, 5, 4, 3, 2, 1. We'll do one more breath like that, because I said 3 deep breaths. Inhale again, hold, and exhale for 6, 5, 4, 3, 2, and 1. And then now we're listening. And really, at this point in time, I don't feel any pain. I just feel myself leaning against the ball. There may still be some next door neighbors to that, and if I roll this direction, oh, yeah, I can find it right there. There's still a sore spot. So what I would do is go ahead and go through that whole process, another another 10 repetitions of the clam, the hip abduction, and the bicycle leg. And then if it's still painful, you can take 3 deep breaths in that spot. But after you've kind of, the other thing is that you're going to want to go ahead and come up on the sacrum a little bit and see if there's any neighbors. So right above that, there's a whole other kind of muscle that could also be contributing to the tightness in your hip. And yeah, personally, I found a couple of other spots up here that I could address, and I would address those in the same way that I addressed the first spot. So after you've addressed those, and we're not spending a lot of time doing this, it's just the 3 motions and then the 3 deep breaths, and then you go on to the next spot. But once you've done that, you want to go ahead and stretch. So you can stretch either in sitting or in lying down. I like to give this stretch to people in sitting because you can do it through your day. So if you're flexible enough to be sitting and be able to feel the stretch here. So we can do this in a couple of different ways, and I always tell people own this stretch because this muscle is a fan-shaped muscle, and so if you get into this position and you don't feel any stretch, then those fibers don't need the stretch. Maybe if you bring your knee up towards your opposite shoulder, then you'll feel the stretch a little bit more deeply or differently. It may be if you cross the foot over and try to stretch it across toward the shoulder, that way you'll feel it differently there too. And so you just try to basically own the stretch and really find where it feels the best for you. And when I mean best, I mean it's stretching. You can feel it. But you're gonna, once you find that spot, you'll hold it for 3 deep breaths again. So let's practice that. Inhale for 2. Hold for 2. Exhale 6, 5, 4, 3, 2, 1. Inhale for 2. Hold for 2. Exhale 6, 5, 4, 3, 2, 1. One more of those. Inhale for 2. Hold 2. Exhale 6, 5, 4, 3, 2, and 1. And there you go. That's how you're going to release the hip muscles, take the pressure off your back so that the back can be stable and your hips can be mobile. I wish you good health and that you can live your best life.